So recently, I received a question from a mother whose baby was diagnosed with HIE after a term medical induction. She watched my last video on prolonged labor and asked if prolonged labor during a medical induction might have played a role in her baby's HIE brain injury and if this HIE brain injury was something that could have been prevented. Hello, I'm Marcus Boss. I'm a birth injury lawyer and I work closely with families who are navigating these types of difficult situations. And I often hear questions like this, and I want to share with you some of the things that I look for when I'm helping families begin to understand whether the medical care during labor and delivery could have been different. If your baby was diagnosed with HIE after a term medical induction, and whether you are wondering if the injury could have been prevented. I'm here to help you understand this process and what, as birth injury lawyers, some of the things that we're looking for. A term medical induction is when doctors start labor for medical reasons instead of waiting for labor to begin naturally. Sometimes medications like Pitocin, sometimes they are used to stimulate contractions, although not every induction is going to involve Pitocin. In many cases, the decision to induce is made when health concerns arise for mother or for baby. This could be something like gestational hypertension, where it may not be safe for the pregnancy to continue, or gestational diabetes, these types of things. But here's the thing, an induction, especially one that leads to a prolonged labor, can create a lot of pressure on both baby and mother. And for the baby, the risk is especially high. Prolonged labor can mean that the baby is under stress, which can lead to a lack of oxygen. When that happens, it can cause injuries like Hypoxic-Ischemic Encephalopathy, or HIE. It's a type of brain injury in our context that happens when the baby is deprived of oxygen during labor and delivery. So for the mother, it can lead to complications like uterine fatigue, which can even delay labor even further. Now, hospitals and doctors, they often will have their own explanations as to why things went the way they did. Sometimes they might argue that the injury was unavoidable because of something that happened earlier in pregnancy, like a genetic issue or a condition that was beyond anyone's control. Others might say that, despite everything, the injury was bound to happen and there was really nothing that could have been done differently to get to another outcome. But here's where these types of questions, or these questions, this is where they come into play. When I look at cases like this, I ask a few important questions. First, was there a medical reason to induce labor in the first place? Was the decision to start the induction carefully considered, and was the possible risk weighted against the benefits? Next, you want to know, was the baby monitored throughout the process? Was continuous monitoring going on? One of the most important aspects of labor is monitoring, especially when you're dealing with a medically induced situation. You want to know what the baby's heart rate is. If there are signs of distress like irregular or non-reassuring heart rates, did the medical team act quickly enough to address it? Did they change course of action? Maybe adjusting the Pitocin or considering a C-section if labor wasn't progressing. When reviewing cases like this, we will look at these types of things. We're going to look to see, was there improper use of Pitocin, where it might have been administered too aggressively or without proper adjustments. If the labor was continuing for too long without interventions, like a timely recommendation for a C-section, that could be another sign of potential negligence. Missing or incomplete medical records, especially when it comes to monitoring the baby's well-being, these can also be red flags that need to be investigated further. These are all the types of factors that we will consider when we're helping families understand whether something could have been done differently to potentially prevent the HIE brain injury. As a mother, you're probably feeling a lot of emotions with this right now, and it's not easy to hear that something might have gone wrong during your delivery. You're likely wondering, could this injury have been avoided? Was something else that could have been done to prevent this? And that's where I come in. I work with families to get the answers that they need, and I'm not going to charge you any money up front to do a birth injury investigation for these, because I understand the importance of trying to get to the truth and to try to figure out what was going on during labor and delivery when your baby has an HIE brain injury. If your baby was diagnosed with HIE after a term medical induction and you're questioning whether a prolonged labor played a role in the injury, you're not alone if this is going on with you. Investigating these types of cases and helping families understand what happened is something that you deserve answers to. Again, I'm Marcus Boston, and if you have any other questions about your baby's HIE brain injury at birth from a medical legal standpoint, don't hesitate to reach out and contact me. You can find out more information about me if you take a look at my information in my contact info in my profile, or you could just wait for the picture that follows this video. All right, that's going to be it for this morning's quick educational video. Have a great day, everybody.